Hello and welcome. Today, we're delving into a rare and complex condition affecting the urinary system, bladder amyloidosis. Join us as we explore its causes, effects, diagnosis, and potential treatments. Bladder amyloidosis occurs when abnormal proteins, known as amyloid, deposit in the bladder's tissues. These deposits aren't normally found in the body. While the precise cause can be elusive, bladder amyloidosis is often associated with systemic amyloidosis, where amyloid deposits affect multiple organs. In some cases, it can occur as a localized process within the bladder itself. Contributing factors may include chronic inflammation, certain genetic predispositions, or even associations with some plasma cell disorders. Determining the underlying cause is critical for effective management. The deposition of amyloid disrupts the normal structure and function of the bladder. Amyloid infiltrates the bladder wall, causing thickening and rigidity. This thickening can impair the bladder's ability to stretch and contract effectively, leading to reduced bladder capacity and increased urinary frequency. The amyloid deposits can also damage the blood vessels and nerves within the bladder wall, potentially leading to bleeding and pain. Ultimately, this disruption of normal bladder function results in the various symptoms experienced by individuals with bladder amyloidosis. Bladder amyloidosis is considered a rare condition, and precise epidemiological data is limited. It's often underdiagnosed, as its symptoms can mimic those of other more common bladder disorders. It affects both men and women, and while it can occur at any age, it's more frequently diagnosed in older adults. Further research is needed to fully understand the prevalence and distribution of this condition. The symptoms of bladder amyloidosis can vary depending on the extent and location of the amyloid deposits. Common symptoms include increased urinary frequency, urgency, and nocturia, which is the need to urinate frequently at night. Patients may also experience dysuria, or painful urination, and hematuria, which is blood in the urine. In some cases, the bladder dysfunction can lead to urinary incontinence or, rarely, urinary retention. Pain in the pelvic region is also a possibility. Diagnosing bladder amyloidosis typically involves a combination of clinical evaluation and diagnostic testing. A urine analysis can detect blood or protein in the urine. Cystoscopy, a procedure where a thin tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining and can reveal characteristic changes such as thickening or lesions. Biopsy of the bladder wall is crucial for confirming the diagnosis. The tissue sample is examined under a microscope to identify the presence of amyloid deposits, often using special staining techniques like Congo red staining. Further tests may be necessary to determine if the amyloidosis is localized or part of a systemic process. While bladder amyloidosis itself doesn't have specific subtypes, it's important to distinguish between localized and systemic amyloidosis. In localized bladder amyloidosis, the amyloid deposits are confined to the bladder. Systemic amyloidosis, on the other hand, involves amyloid deposits in multiple organs, including the bladder. The type of amyloid protein involved, e.g. ALA-AATTR, further characterizes the underlying systemic amyloidosis and influences treatment strategies. Treatment for bladder amyloidosis focuses on managing the symptoms and slowing the progression of the disease. There is no cure for amyloidosis. Symptomatic relief can be achieved through medications to manage urinary frequency, urgency, and pain. In some cases, bladder irrigation with certain solutions may help to reduce bleeding. Surgical interventions such as transurethral resection of the bladder, a TURB, may be considered to remove localized areas of amyloid deposition, but this is not a long-term solution. If the bladder amyloidosis is part of a systemic amyloidosis, treatment of the underlying systemic condition is crucial. This may involve chemotherapy or other therapies to reduce the production of amyloid protein. Currently, there are no definitive preventative measures for bladder amyloidosis, especially in cases of systemic amyloidosis. Maintaining good overall health, addressing underlying inflammatory conditions promptly, and avoiding exposure to known risk factors for amyloidosis may be beneficial. Early diagnosis and treatment of systemic conditions that can lead to amyloidosis are critical to prevent the deposition of amyloid in the bladder and other organs. The prognosis for bladder amyloidosis varies depending on the extent of the disease, the type of amyloid protein involved, and the presence of systemic amyloidosis. Localized bladder amyloidosis may have a relatively better prognosis with symptom management. Systemic amyloidosis carries a more guarded prognosis due to the involvement of multiple organs. Recent research focuses on developing more effective therapies to target the underlying amyloid protein and prevent further deposition. Clinical trials are exploring novel approaches, including antibody therapies and small molecule inhibitors, to improve outcomes for patients with amyloidosis. Continued research is crucial to advancing our understanding and treatment of this complex condition. Thank you for watching.